This video is a demonstration of an influenza monitoring system developed over the past 2 years by the Rhodes Laboratory at the University of Pittsburgh. The system is in operation in Allegheny County, which has a population of 1.2 million and includes the city of Pittsburgh. The influenza monitoring system is a web application that can display daily counts of various types of disease surveillance data derived from sources such as laboratory results, emergency department chief complaints, doctor dictations, and retail sales. These data are available for the 5-year period, June 2007 to the present. The screen is showing daily counts of positive influenza laboratory tests for patients who sought treatment in 7 emergency departments in Allegheny County. The maximum daily count, 31 individuals testing positive, occurred on October 26, 2009, which corresponds to the peak of the H1N1 epidemic in Allegheny County. The other peaks correspond to flu outbreaks in Allegheny County in 2008, 2009, and 2011. The influenza monitoring system has 3 unique features, which I will emphasize in this video. The first is this plot of the daily counts of ED patients with influenza, as estimated from physician dictations by a Bayesian case detection system. The maximum daily count of about 128 ED patients with influenza occurred on October 26, 2009. Each daily count plotted on this graph is the sum of the posterior probabilities of influenza for the set of ED patients seen on that day. The prior probabilities for each day used in these calculations come from an outbreak detection system. In contrast to other types of surveillance data, such as ED constitutional chief complaints and thermometer sales, the daily counts of ED patients with influenza show strong signal-to-noise for influenza outbreaks, with almost 0 counts during inter-outbreak periods. The second unique feature is the ability to compute the probability that an outbreak of influenza is ongoing on a particular date, given the ED dictations up to that date. For May 30th, the computed probability of an influenza outbreak is 0.0122. An obvious use for this probability is as an alert criterion. That is, a user could be notified when the probability exceeds some threshold. We can examine the probabilities of outbreak computed for each day of the 5-year period. The probability scale is a secondary axis on the right. The probability of influenza outbreak approached 1.0 on 5 occasions during the 5 years. On 4 of these occasions, EDs were showing rising numbers of patients testing positive for influenza. The third unique feature is the ability to estimate the daily incidence of influenza in the population. To demonstrate this feature, let's find the day in September 2009 when the probability of an influenza outbreak approached 1.0. We can use this control to narrow the time interval to the 6 months surrounding September 2009. We see that the probability approaches 1.0 on September 12th. By clicking on that point, the system will change the current date to September 12th and retrieve the population incidence of influenza that it computed for Allegheny County for that date. Before we look at the population incidence, let's review the surveillance data available on that day. We see that the daily count of patients testing positive for influenza in EDs had been varying between 0 and 10 without an upward trend. We also see that the number of ED cases of influenza, as estimated by the case detection system, had been rising, and that counts of constitutional chief complaints had been trending upwards, with the 7-day moving average having risen from 58 to 74, as had daily thermometer sales, which more than doubled from 40 to more than 100. Although these data suggest strongly that an influenza outbreak was ongoing, it would have been difficult, if not impossible, from visible inspection to predict the future time course of this outbreak or when it would peak from these surveillance data. This red line is the estimated daily population incidence in Allegheny County, as computed by the Outbreak Detection System, using as the only source of surveillance data information in physician dictations. The axis for the population incidence is to the right. The estimated population incidence on September 12th was nearly 1,000 cases per day. The outbreak was predicted to peak on October 22nd, with an incidence of nearly 10,000 cases per day on that date. We can compare the predicted peak date for the population to the peak date observed in the surveillance data by clicking the Show Radio button. We see that the predicted incidence of almost 10,000 cases per day in the population coincides with the observed peak in thermometer sales of 316 units per day and the observed peak in positive lab tests of 31 per day. The system computes a Bayesian credible interval for the incidence curve and the area under the curve, which is an estimate of the total number infected. We can also see the results of a decision analysis of several disease control interventions, in particular whether to intervene with H1N1 vaccine in adjuvanted or non-adjuvanted forms, and whether to increase the vaccine administration capacity of Allegheny County from 5,000 vaccinations per day to a level at which all received vaccine could be administered as it was received. The H1N1 vaccine was not expected to become available until early October, and the quantity of vaccine without adjuvant was expected to be small relative to the population. Finally, we can inspect the set of SEIR epidemic models from which the expected population incidence curve was derived, including their parameters and incidence curves. The posterior distributions over 3 epidemic parameters are not latent period and infectious period, and distributions for the outbreak characteristics, outbreak size, peak day, and peak incidence.